Hello everyone. Today we will be discussing questions related with ECG. The first question is, who developed an electrocardiogram? Option A, Wilhelm His. Option B, Stewart. Option C, Hubert Mann. Option D, Willem Einthoven. The correct answer here is D, Willem Einthoven. Willem Einthoven is the correct answer here. Next, we'll see. Willem Einthoven found the beat and built a machine that could measure the electrical current a heart creates. It weighed 600 pounds. An electrocardiogram, called informally an ECG or EKG, measures the small electric waves that a human heart creates. It's been doing it for more than a century. Next question. In the case of a normal heartbeat, depolarization stimulus arises in which of the following? Option A, epicardium. Option B, sinoatrial node, which is also known as SA node. Option C, atrioventricular node, AV node. Option D, His bundle. Correct answer here is B, sinoatrial node. Depolarization means contraction of the heart, whereas repolarization means relaxation of the heart. We will come across this term frequently in the next questions. This particular question is asking about conduction system of the heart. We will be discussing in brief about the conduction system of the heart. This is a photo of heart. First, there is an atrial node located at the right atrium, near the inferior vena cava, and from SA node, which is also known as natural pacemaker of the heart. From SA node, impulses are being generated into AV node. AV node is located in the lower aspect of the atrium. As you can see here, lower aspect of the atrium, and is exactly located at the myocardium. That is, the myocardium is the layers of the heart at the muscular layer of the heart. Question, they used to ask question, where is AV node is located? The correct answer here is myocardium. Okay, we can continue. From SA node, impulses are being generated into AV node. From AV node into bundle of His, and further it is transmitted into right bundle branch and left bundle branch. Further, it is being divided into Purkinje fibers, the small fibers at the apex of the heart, which helps in contraction of the heart during electrical activity, which causes contraction of the ventricles. So again, I repeat, this is a conduction system of the heart. First, from SA node, which is located at the right atrium near the inferior vena cava. From there, impulses are being generated and it has impulses reach into AV node, which is located at the myocardium. And from the AV node, impulses are being transmitted into bundle of His. From bundle of His, it is transmitted into right bundle branch and left bundle branch, and is further transmitted into Purkinje fibers. The small fibers here is called as Purkinje fibers, which helps in the contraction of the ventricles. Next question we'll see. What does the T wave represent? Option A, depolarization of the atria. Option B, depolarization of the ventricles. Option C, represents the repolarization of the ventricles. Option D, depolarization of the atria and ventricles. Correct answer here is A. P wave represents depolarization of the atria, which means contraction of the atria. We will be discussing about the different ECG waveform and what it's represent. Waveforms of ECG. This is a P wave, this is a Q wave, PQ, this is R, this is P, Q, R, this is S, this is T. U wave is normally absent in ECG. P wave indicates atrial depolarization, which means atrial contraction. QRS complex, this is a QRS complex. It represents ventricular depolarization, whereas T wave indicates ventricular repolarization, which means relaxation. U wave is unknown. Next question, counting the number of QRS complexes, which of the following can be interpreted? Option A, rate of heartbeat. B, rate of breathing. C, cardiac output. D, stroke volume. Correct answer is A, rate of heartbeat. In a normal ECG, this is P, Q, R, S, T. This is my bad handwriting. P, Q, R, S, maybe. This is P, this is Q, this is R, this is S, and this is T. This is a normal ECG. In an ECG, there is multiple of this PQRS. So the number of QRS complex between them, and we have to do. Let's see in the next photo. I have photo will be more clear. This is a normal ECG. P, Q, R, S, T. Here it will be more clear calculating the rate. This is a QRS complex, this is a QRS. If we count, there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. There are 13 QRS complex in this particular ECG in the lead one. So how we'll get a heart rate? We have to multiply this 13 into 6 here. Heart rate is equal 13, we get the QRS complex into 6. 6 is a constant value. So if we multiply 13 into 6, we'll get the heart rate 78 per minute. This is the formula. Number of waves in 10-second strips into 6. 13 into 6, we get 78 beats per minute. We can also calculate the heart rate of a patient by calculating the small squares. As we can see in this ECG, this is big squares and there are small squares. By using this small square or large box or large square, we can calculate the heart rate of the patient. Let's see how can we calculate using the small squares and large squares. This is formula. Rate is equal 300 divided the number of big squares. If we are calculating the number of big squares, we have to divide it with 300. If we are counting the number of small squares, we have to divide with it 1500. Let's see how can we do that. For examples, in this particular ECG, we can see here, this is a big boxes, 1, 2, and this half, I mean 3 large boxes. 3 large boxes, and we have to divide it by with 300, so 100 beats per minute. And if we counted the small square will be total 15. The small square will be 15, because in each box there are 5, 1, 2, 3, 4. There are 5 smalls. In each large square there are 5 small squares. So 5 small squares equal to 1 light square. So we can see here 5 5 10 means 10, 5 5 10, 11 12 13 14 15 15. That means 15 small squares we have to divide it with 1500. So the correct answer, both we get the same answer, that is 100 beats per minute. That's how we can calculate a heart rate using an ECG with a small box and large box, large square or small squares. Next, the classic ECG changes in a myocardial infarction MI are: option A, T wave inversion; option B, ST segment elevation; option C, development of an abnormal Q wave; option D, all the above. Correct answer here is D. This is a very commonly asked question in most competitive exams, either in state or CHO or central government. This is a very important question. This is a normal ECG. This is P, this is Q, this is R, this is S, T. So in MI patient there is a tall T wave. This is wide and tall, but in the MI patient a tall T wave will be there. If we see a tall T wave, that means indicates MI. This is actually an early sign of an acute MI, tall T waves. ST elevation, as you can see here, this S and T is elevated. This is also present in MI patient. T wave inversion, P, Q, P, Q, R, S, T. This T is supposed to be should be up, but here there is inversion. So T wave inversion also are present in chronic MI. T wave inversion is seen. Okay, this is a normal ECG again. So there are these 3 waves present in MI patient, 3 ECG abnormality in MI patient. First, there is tall T waves. Second, ST elevation. Third is T wave inversion present in chronic MI. And all of these are present in MI patient. Next questions. In which of these conditions can widened QRS and tall tented T waves be observed? This widened QRS complex and tall T waves is present in hyperkalemia also. This is a very commonly asked question. It's very important. Next questions. Leads V3 and V4 represent which of the following views of the heart? Option A, septal; option B, inferior; option C, anterior; option D, lateral. The correct answer here is anterior. We will be discussing in next slides. As we know, there are 12 leads. ECG, there are 12 leads. There are 1, 2, 3. These 3 are limb leads, whereas AVF, AVL, AVR are augmented leads, and V1 to V6 are called as precordial or chest leads. They are unipolar, whereas this 1, 2, 3 are bipolar leads. So view of the heart, this ECG leads, this 1, 3F and AV1, 3 and AVF, it shows the inferior view of the heart. Lateral 1 AVL, V5, V6 AVR shows the lateral, and an anterior view of the heart shows V3, V4, septal V1, V2. From this leads actually we can tell in MI patient there is anterior wall MI. If there is ST elevation in this leads, if there is ST elevation in this 2, 3 and AVF leads, it is called inferior MI. If there is an ST elevation in these 3 leads, that means inferior part of the heart is being blocked, there is ischemia. So if there is ST elevation in 1, AVL, AVR, V5 and V6, that is lateral part of the heart, is their lateral MI, it's called lateral MI, that is ischemia in the lateral part of the heart. Anterior part of the heart, if there is ST elevation in V3 and V4 ECG leads, there is MI, anterior MI. Septal MI, if there is ST elevation in V1, V2. So if we know that which leads represent which part of view of the heart, from there we can classify it as anterior MI, inferior wall MI, lateral wall MI, and etc. So this is very important and is commonly asked especially in NORCETs, AIMS, Delhi is commonly asked questions. Next, QRS complex normal duration is option A 0.04 seconds, 1 small square. I have discussed before, in each ECG there is that one large square. In each large square there are 5 small boxes. This is a large square and this is a small square, and the duration is of this small square is 0.04, and if it is 2 is 0.08, if it is 3, correct answer QRS complex it is 0.12 seconds. That's 3 small squares. These 3 small square is the duration of QRS complex, which means a QRS complex occupies these 3 small squares. So duration is 0.112 seconds. Each small square is 0.04 seconds duration. So as we can see, as we have discussed this now, that the QRS complex occupies these 3 small squares. That means if we multiply 0.04 into 3, we get 0.112. So QRS complex normal duration is 0.12. What we have to remember here is the normal duration in a small box square. In this small box square, normal duration is 0.04 seconds. And we also have to remember that in a QRS complex, how many small squares is occupied? 3 small squares. That's how we can multiply 0.04 into 3. We got the answer 0.12. Next question. Here we'll discuss a little more details. As you can see here, in each, this is 0.2. Here they wrote 0.04, they wrote, that means 0.04 seconds in these smalls, as I have discussed just now. And diameter is, this small one, this diameter is 1 mm. So 5 of them, that means large is 5 mm. 1, 2, 3, 4, 5. This large square, that means 5 mm. The small square's diameter is 1 mm. And the amplitude between 1 to is 1 millivolts. Okay. This is also very commonly asked questions. What is the paper speed of an ECG? 25 mm per second. That means in each large square there is 5 mm, 5 here, 5, 5, 5, 5. That means per second in ECG it printed 5 light square. 1 2 1 1 2 3 4 5. That's how paper speeds of an ECG 25 mm per second. This is a very commonly asked question. It's a very important. Very important. What is the paper speed of an ECG? That means 25 mm per second. That means 5 light square. 1 2 3 4 5 per second. ECG printed 25 mm per second. Next questions. If there are 3 light square in an RR interval, what would be the heart rate? Just now we have discussed about this question. If there are 3 light square in an RR interval, what would be the heart rate? If we are calculating the light square, that means we have to divide it 300 divided by 3. That means 100. Correct answer is B. If we are calculating the small square, we have to divide it with 1500. So we have to count here with the small squares. This particular question is giving us about 3 light squares between 2 RR interval. So that's how we got 300 divided by 3. To calculate the heart rate from an ECG, you can count the number of light squares in an RR interval. As we have already discussed, between 2 RR interval, we have to count the number of light squares, then divide by 300 by this number. Therefore, answer is 300 divided by 3 is 100 beats per minute. Thank you. That's it for today. If you feel our channel is better,